give everyone a second to jump in. Hearts, if this is awesome. Isn't she awesome, you guys? I seriously just, I wish everyone could use her. All
you
of
know what?
Can you just...
Midwives are, midwives belong in most areas. Hi, everybody. Thanks for coming back.
Midwives are all amazing, but you and Marlene are next level.
That's just because we have to.
You are.
Well, I'm bringing everything of what we are and who we are and what we know to you through the media. This was a whole new process for me. Those 40 Ps are the first start, and then there'll be a whole online series that you can go to. And my goal is to get midwifery care back out to all of you, no matter what birth you're going to have.
She's like the modern day Ina May Gaston.
Ooh.
I said it.
That was big. Don't let Ina May hear you say that.
Okay. What were we talking about? Oh, finding a good midwife.
Yes.
Okay, so interview. And
yes.
I think interview, like I know in the beginning I was seeing a doctor and I was seeing them at the same time because I just didn't know what I wanted. And so you can do that. You can see multiple doctors. You can, you are in charge of your birth and you are hiring them to assist you in the experience you want. It's not the other way around. So find someone that will help you get the experience that you want to have.
Yes. And, often I say interview 2 or 3 because you need to be able to find what that connection is with them and they with you because they're going to follow you on a really important journey. And if you're looking for a midwife, yes. Now, some of you may not live in a state because not every state in the United States has legal midwifery for home deliveries. So you may have to really look, and your health food stores, naturopaths, acupuncturists, chiropractors often can help you out with that. But in California, it's a matter of interviewing, and there are almost probably close to 575 midwives in California now.
Oh gosh. My clinic makes us sign a contract that we won't seek other care at the same time. If we do, we get fired as patients.
Yeah.
I would say
yes.
Great.
Okay, so
I'm out of here.
I don't know what state you live in, but that's what has happened here in California many times. And it used to be the, don't talk, don't tell type of thing. It's like the physicians sort of like knew that they were seeing a midwife, but as long as nobody said anything, everything was fine. And it used to be that we still have to say that to families. You can go in, and if you tell your physician that you're going to have a midwife and you're going to have a home birth, they may release you from care. But here's why. It's because it's a liability issue, okay? It's like if you have 2 different care providers, who's responsible if something happens to you or the baby? And the docs don't want to be, and I understand this, the docs don't want to be responsible for something that the midwife might do with you.
I get that.
Because if you're going to have a baby with a midwife and at home and you're seeing a physician and something happens, the physician's going to get pulled in and they are then going to have to be liable. Because in California, it used to be worse because they had to supervise us, but we never met them or never saw them. We don't have to have supervising physicians anymore because it was never working. So, yes, sometimes you have to play that game. It's a lousy game.
Yeah, but there's a difference between seeing multiple care providers, which I did do in the beginning, and interviewing. And you can interview as many as you want, I think, without that rule.
Yeah.
Affecting.
Oh, yeah. And find one you like.
Yeah, for sure. I didn't have to look very far. You guys were my first ones, and I knew. Okay, let's talk about VBAC.
Okay.
I get that question a lot.
All right. So VBAC. A VBAC should always be attempted unless you've had a classical scar, which means that your internal incision goes from top to bottom. That one is considered not a safe way to have a VBAC.
And they never really do that anymore, right?
It's very, very rare. Usually it's an emergency cesarean where the placenta's in a funny place and they have no choice. Okay. Other than that, it's always going across. And the one thing to remember is that the muscle fibers of the uterus shorten, right? They don't stretch out. But the supposedness is that that area where the scar was is more at risk of separation. Now, when we go about supporting a VBAC, we do a few things. One, we want a healthy pregnancy, and we want that mom to do her research and understand the benefits and the risks of having a VBAC out of the hospital or in the hospital. And it's a very different way that they are handled. And when labor is coming along, you're looking at how well the baby's heart tones are, how the pain concern is to the mom, and how the labor is progressing. And when everything is going like normal, life is good. And when you do a lot of research on having VBACs and the worry of a rupture happening, you find that the majority of people, it's women who have never had a cesarean that there are more ruptures on. So, go take a look. So for us, we work on the emotional side too. How did the section happen? Maybe it was a breech baby and you never got to go into labor in the first place. So it's like a first birth. We don't have any history on that. Maybe you had a labor that you only progressed to 5 centimeters. Well, we have to be able to get you emotionally past 5 centimeters, which means don't ever tell you if we check you that you're 5 centimeters, because your brain's going to go, oh no, it's happening again. So we want to be able to have that go as smooth as possible. So we do a lot of emotional work, writing down what happened last time and how you're going to do things differently, whether that's in the hospital or at home. Definitely have a doula if you're having a VBAC. Stay home longer until your contraction patterns are really working really well. And when you go in, just know that there are going to be certain protocols, such as an IV, and that's at the risk if anything were to occur. They want a line that's open. And usually you have to have monitoring pretty consistently because they want to listen to the baby. But what's sad to me is when a lot of interventions come into a VBAC and they end up with another section that maybe wasn't necessary. Yeah. When I hear somebody who goes in and they were complete when they walked in, and then there was, they started pushing maybe 10 minutes and their baby's heart rate dropped, and boom, they were in for the section. And I think, was it really that there was a problem here, or was everybody just worried about it and they took you in? Mm-hmm. Now, even the docs are having to reduce the cesarean rate because there's too many infections and there's too much bleeding and there's too many problems that are happening for moms.
So they're trying to get nationwide people to reduce that?
They're trying to. Yeah. It's going to be slow. It's slow progress.
Yeah. Yeah.
One more thing about VBACs. That front segment of the uterus, because of where the cut was, can sometimes be a little lazy. It doesn't always get the same nerve conductivity. And so many women who have had a cesarean, they'll have what we call a cervical lip. Mm. It'll hang out in there.
I know what that is.
Yeah, and anybody can. And you have to labor it for a while, and then sometimes you just have to push it over the baby's head just one good time, and the baby comes out. So just know if that cervical lip's there, ask somebody, is it reducible?
Yeah. Is it reducible? If you have a cervical lip, ask if it's reducible. There we go. Okay, we talked about VBACs. That was good. So you probably have a lot of women that come to you for a home birth following a VBAC or following a cesarean.
A lot.
A lot? What percentage of moms that you see?
I bet we see maybe 5%.
5%.
Okay. I do think there's a lot of fear around.
Yeah, I get that.
Things.
I get that.
Yeah.
Because usually I think if you've had an emergency C-section, that is a traumatic experience.
Yeah.
For me, it would be. And so then, yeah.
And I think their partners oftentimes are rather fearful because what they saw versus what the birth giver was going through is a little more of an urgent thing.
Yeah.
And so that can be hard.
Someone says, when you say labor at home as long as possible, how do you know when you should go in?
It's a great question. So, it depends on how far away you are from the hospital, right? And what number baby this is for you. With a first baby, If you're under 5 minutes apart, closer to 3 minutes apart, lasting a good 60 seconds or more, and it's been progressive, where you know that this is labor, then that's a good time to go, so that you get there at about 7 centimeters and you're there a few hours, hopefully, before your baby is born. Just know that the car ride is not real comfortable. So you just breathe through it, knowing that this is part of your journey, right? And when you get there, you put yourself in the bubble and you say, you know what, whatever stuff they have to do, they can do it. My job is just to keep going forward and just birth my baby, because guess what? If they're not ready, somebody's going to come in and help make sure your baby gets caught. It doesn't matter if everything is perfectly set up, even though they like that. And I understand why. But it's important that you are just owning your birth. That's how the birth will work the best. Okay, so that's one. Babies that are first babies that get under 5 minutes, you need to head up there so that you're at the hospital by the time you're about 3 minutes apart. Subsequent babies, that goes faster. So once you go under about 7 minutes and you're heading towards 5, it's a good time to start making your way there, because by the time you get there, again, you're going to be about 3 minutes apart, and you know your baby's going to be born. First time moms, sometimes it can go down to 3 minutes apart and it still may be a few hours. But you know, again, it depends on how far away you are from your hospital, whether it's traffic hour, whether you have to get kids to, you know, family's house or whatever you have to do. For us, we are usually at a family's house a couple of hours before the baby is born. If we're there too early that you can sit and talk to me like this and there's not enough going on, I guarantee you're going to feel like a watch pot.
That makes me feel bad, though. Not bad, but you guys are always there with me for like 9 hours.
I don't remember.
Well, no, it's been like... Well, with Benny, it was like 5 hours. You got there at midnight and I had him at 5:30.
So your babies like to sit with their heads a little funny in you.
I know.
And when that happens, you have to have patience, rest, movement, and then the baby finds its way through. And it does its job. Head position is such a key for a progressive labor.
Yeah.
And a flexible pelvis.
Good. Okay. Let's see. Okay. Let's talk. Okay, what do you have to say about like when your doctor says your baby's really big and they're concerned about that?
So first of all, being able to gauge how big a baby is just from palpation is an art, and an ultrasound isn't always accurate. Sometimes it can be off by a pound or more. Sometimes it may be accurate, but more often than not, they're off. So I know for us, when we palpate, we get pretty close to feeling how big babies are. But in our home birth practice, how are we doing?
Sorry, you're good. Keep going.
Okay. In our home birth practice, we got comments galore going on. It's normal for us to have babies 8.5 to 9.5 to 10 pounds. And what's considered a bigger baby in a hospital setting is about 8 pounds, 13 ounces. That's considered a baby that's what they might consider gestational, and they want to do more blood sugar checks. For us, that's just really a good, normal, healthy baby. Now, it doesn't mean that we don't have 7 pounds and 6 pound babies. We do. But I'd say more often than not, they're over 8 pounds, closer to 9 pounds.
And what about a larger baby getting stuck or coming through the birth canal?
So when labor establishes itself on its own and it's able to go forward and there's not medications on board that can reduce the effect of pushing or change how the pelvis is working. Sorry. Babies fit through very nicely on progress. And once in a while, there's a baby who its shoulders may get a little bit tight. And that's really where, number one, you learn very early in midwifery care, when we teach students, never let the mother see you sweat. In other words, if you scare her, her oxytocin's going to drop and she won't have as much power. her fear will come up and she'll tighten up. So you keep wooing her, telling her what she needs to do, and as midwives we go in and we just get the shoulders and bring the baby out. And I tell students all the time, there's not an option. The baby has to come out. And the babies come out. So bigger babies sometimes have a harder time and sometimes they don't. I can tell you I've had challenges with 6-pound babies because they're tinier and they get their heads all kind of funny. And the only ones that I can say that have really given me that breath of, okay, Mom, now I'm going to get intense with you about getting this baby out, is when we've had an 11 or 12 pounder, okay? Those are big babies. 11s and 12-pound babies, they are big babies, and yes, they take a little oomph to get out. But, 10-pound babies, no. Now, if it's a mom who's like 4 feet 10 and she has a tiny pelvis, you do not know what size baby she can birth until she goes through labor and her hormones soften her. Okay? No, she's probably not going to grow and birth a 10-pound baby. Her body knows to grow a baby that's more appropriate for her size.
Awesome. Okay. Question, does broken water mean that a pregnant woman needs to go to the hospital immediately, or can she wait till she gets regular contractions?
So if you're at term and your baby is head down and it's nice and engaged in your pelvis, then there's not a risk that the cord would ever come before the baby. It's always helpful to monitor the baby's activity if membranes let go. What we do is we have known how far down a baby is. So if a mom calls us and she says, my water release, first of all, we want to know, is it a lot? So that we know that it's really the forebag or the bag that's over the baby's head, or is it just a little trickle that she thinks is coming out? And we always say, let's see what the next hour, hour and a half does. Because sometimes you can get, you realize you have 2 bags in there, they're adhered to each other, and sometimes the first bag breaks, sometimes it's a high leak, and sometimes it's a whole lot of watery vaginal mucus that can run down your leg and make a puddle on the bed.
Wait, there's 2 bags?
There's 2 bags.
I never knew that.
There's an outer bag called a chorion and an inner bag that's called the amnion, and they're adhered together.
Okay,
if you ever get a chance, yeah, because you have to separate them to get them apart. But there's a fluid that runs between them. So when water's released like that, is the baby active? Is the water clear? Sometimes it can be a little bit pink or blood tinged as the cervix is dilating, but it should be clear. And you want to make sure that the baby's activity level is good and that the baby is well in the pelvis. If you're like 35 weeks, you really should go in, because babies sometimes are floating and you don't want to have a baby concerned with that. But we often will and then we'll go out and check on the baby. We'll listen to heart tones. We're not going to check a woman vaginally if she's had her membranes rupture. Why? Because we don't want to institute infection in there. Leave it alone. Most women will start labor, if it's a really good break, within an hour or 2 or within 24 hours. If they don't start within 24 hours, we put them on some herbs, and we'd like them to get started within 48, as long as there's no infection, no fever, and they've had a culture that is GBS negative.
Okay, that was so good. So much information. Okay, so that's if a woman's water breaks at term. What if it's premature rupture of membranes?
So let's say they rupture at like 35 weeks. Okay, so if you've ruptured at 35 weeks and you think that's what it is, you need to go in. You need to make sure that the baby's engaged well and have somebody monitor what's going on, because if your baby's going to be born 35 weeks, you need to be in the hospital.
Yeah. Okay. What about meconium in the fluid?
So it's very interesting, because fluid is supposed to be clear. And over my course of time, as I've seen some fluid that was pulled out, that there was no stress, sometimes it's not always completely clear. Sometimes it's a very light pale yellow, almost as though it was like pee, if you will. But it should be clear, okay? When it's green or greenish brown and there's meconium in it, then it means at some point in time the baby has gotten stressed enough that it has caused the baby to poop into the water. Now, sometimes it's just being overdue that meconium can come in there. So it's something that the baby should be listened to. And for us, if we see it, we listen to them, and we listen a little more frequently in labor. And as long as it's thin and it's clear, then, we go forward, as long as the baby isn't telling us anything, because it may have happened a week ago, and it has nothing to do with labor. If there's something going on in the labor and there's meconium, we need to go in, because we want the baby to be safe coming out. And if there's something else the baby needs to tell us by the time we get to pushing, we may need more support with that mom and that baby. But it's rare that we have meconium that we have to go in for. Okay, awesome. Because we don't stress the baby at home, you see?
Yeah. So yeah, meconium during labor is usually because the baby's stressed, and so it probably doesn't happen as much at home because the babies aren't stressed.
Right. Okay. Because they get plenty of oxygen, plenty of perfusion.
Okay. Plenty of oxygen, plenty of perfusion.
Right.
Okay. That was good. Okay. Sorry, I've got... Let's see. Just want to make sure...
Does a broken water mean...
Should we not push until we feel cool. 2 doctors told me to do practice pushes. I always wait until I feel the urge to push. What are practice pushes for? Just...
I think... If somebody comes in and they check you and they say, "Oh, you're 10 centimeters," then they say, "Okay, now let's start doing some pushing." But you have no urge. Now, if you're on an epidural, you may or may not feel that urge, depending on how strong the epidural is. So you may need guidance with that in order to help you with that. If you're not on an epidural, when the baby descends, and even if you're 10 centimeters, labor and breathe through it a little longer. As the baby descends in the pelvis, you will begin to get pressure and an urge to push that usually will overtake you. So rarely do we ever have to tell women to push at home.
Yeah, I remember all of mine. I've just been like, okay, I'm pushing now, and you
have
don't even
no
think about
choice.
it. Yeah, you have. It's just so, and you cannot stop it. It just, your body just does it.
Yeah.
And with Benny, I felt that shift where I was like, okay, I've got to change something. And then I was like, I need to go pee, so let me go pee. I got up, got on the toilet, and I was like, get me to this tub. He is going to come out. I have to push. It was so instinctual. So, yeah, when you can feel it, your body just does it.
And, I was going to go back to water breaking. That's right.
Okay.
It's good.
Someone is asking if labor stops progressing at 6+, is breaking the mother's water helpful, or are there better options, or should she just rest and wait?
Depends on the baby's head position. If you're at 6 and you've been laboring fine, but there's not any progress after however many hours that you feel comfortable with that, if baby's good and you're good, you can keep going. Get up, do some squatting, do some hands and knees, maybe move your hips around in some figure eights, and see if the baby's head position will put some pressure on. Once in a great while, if you've had babies before, sometimes that cervix doesn't get enough pressure, and letting the water go, the baby will come within 10 to 30 minutes. So there's not an absolute answer to that. I would say the majority of the family that we have at home, their babies, their water breaks on its own, and we don't do a lot of releasing water unless it really seems like mom's either this is what she wants, because she says, all my babies, I've always had to have my water broke, just break it. And we'll say, okay, well, let's labor a little bit longer, and let's make sure that we get as much dilation for you, and then we do whatever is, if we think it's a good choice still, because we're not going to do something if we don't think it's a good choice.
Right.
But yeah.
Okay, good.
But you want head position good before you ever let waters go, because if the head position isn't good, once you let the waters go, the baby's in there, and it's hard to change their position.
Yeah, makes sense. Okay, what about
ours? Haha, my first was 8 pounds in 40 minutes. Right on. Yeah. Hey, Jessica. I know the babies come out in the call. Isn't that something when you think your water's broke?
Oh yeah, that's really cool. I wish that would happen to me. That hasn't happened to me. In call means they're born in the amniotic sac. It never broke. You can have your baby still with their water still intact. It's really cool. Okay, let's talk. This is good. We're getting through. What about ultrasounds? What are your in your care? I think I usually get one, and you usually tell me it's optional.
Mm-hmm.
Right?
Yep.
So yeah, what are your thoughts on ultrasound?
If we do a VBAC, then we make it strongly suggestive mandatory.
Yeah.
Because we want to know where the placenta is, because we want to know if it's over the scar, because there's risk factors involved with that. If it's not a VBAC, we discourage families from having early ultrasounds, because when a baby's 6-8 weeks and it's forming heart and lungs and brains and toes and fingers and all of that, and you get in there and kind of jiggle some of those cells, we feel like that could put the baby at risk. And is it going to improve the outcome? A 6 or 8 week ultrasound, the reason that they are done is to prove that the pregnancy is there, and so the insurance can be billed for that ultrasound, and to confirm that the pregnancy is real. Does it improve the outcome? No, it doesn't improve the outcome at all. So the 20-week ultrasound, some families choose to. We say you can have an option to have a full diagnostic anatomy scan of the baby. Will it improve the outcome? Probably not. Is there things that could be detrimental to the baby? Probably not at that point. Baby's formed enough that risk factors are very low. Very few of our families opt to have anatomy scans at that many weeks. A lot of them like to go for the gender only, take a quick look and the picture type things.
Yeah.
And for us, we're like, all right, well, as long as you're going, I'd like to see where your placenta is.
Might as well.
Might as well.
Yeah, I always opt to do the 20-week, I think, just because I want to make sure, there's no spina bifida, there's no body parts outside of the body, there's no, that just gives me peace of mind. But I do always wait till the 20 weeks, and that's the only one I get. I don't know if I would not do it. I like to do it. But I understand why you don't require it, because it doesn't change.
Right.
Even if the baby's missing a leg or whatever, it doesn't change the outcome of.
But if it makes your head and your heart feel more at peace,
secure, yeah,
that's a good reason to have it.
Yeah,
then.
and that's why I do it for me, for sure.
Yeah.
Okay. Let's see. Okay, just checking it. Okay, let's talk. Okay, we talked ultrasounds. What about suggestions for women trying to conceive, and also
Allison's on. I love it.
And also, how soon to stop birth control before trying to conceive? Maybe we could touch a little bit on trying to conceive, and maybe a little bit about birth control, although I am going to be talking about that soon,
good.
But she's the expert.
Oh, no. Yeah. I'm just one that has, my views on it. So with birth control, we suggest, if you've had an IUD, that you have at least one cycle before you try and conceive, so that the lining has a chance, and preferably 2 or 3 would be even better, especially if it's a hormonal. You want your body to get back into harmony again and make sure that that lining has had a chance to reproduce really well. We have seen, a little bit of an increase of miscarriages if the IUD is out and the pregnancy happened before the next cycle. When it comes to hormonal birth control, many times with breastfeeding, some women can't tolerate the hormonal the hormonal birth control. It can reduce milk supply. Sometimes they don't feel good. Truthfully, especially after a baby, you're asking me as far as before you conceive, getting off birth control for at least 3 months. Let your body regulate. Make sure you're taking the methylfolate, because when you take hormonal birth control, it causes your body to deplete in folate, which can cause problems with cell division.
Okay. Interesting. Okay. That was good. I have a question, actually. What would you do for a woman who, say, has been trying to conceive for a year, and she's ovulating, she thinks she's ovulating, and let's say whether she has or had not had a baby before?
Okay.
That's a big question.
That's a big question. So what would I say? Okay, let's
She's coming
let's
to
define
you
this.
for like her care. Like she wants to get pregnant and then have a baby with you.
Okay,
So-
but she's having trouble conceiving.
Trouble conceiving.
Okay, so first we have to go through what her history is. What have her periods been like? How long has she been trying? What point of time in her periods or in her cycle is she trying? Has she had difficulty? Has she had some miscarriages? Or has she never gotten pregnant before? Are her cycles regular? How much does she weigh? Is she very, very thin? Is she very, very heavy? Does she have PCOS, polycystic ovarian syndrome? So there's a lot of variabilities.
So you'll do like a full medical.
Yeah, because you've got to find out. Maybe she has thyroid issues.
So for like, say like me, like I've had 3 babies. Say I just like want another and I cannot
get pregnant. Okay.
So I'm like relatively healthy.
So what we would do in that situation is we'd say, okay, let's up your nutrition with certain things. Okay, lots of greens, some green powders. And then I would say we can put you on some herbs. Vitex is a great herb. Research that. It's good for helping with Vitex, which is chase tree berry. That's a great one for helping you want to ovulate. It's also, you could take temp charts. Some people, if they're really familiar with their mucus,
that's what
they can do that.
We're going to talk about that.
Yeah. So it's a matter of saying, well, what might be going on? And sometimes it's that people can be too thin and their thyroid is struggling with being able to help with all of that. Because if you're too thin, you don't have enough hormones to help you be able to maintain that. So we had someone in recently and we said, we need you to gain 5 pounds. And she says, on what? So I had to give her dietary recommendations because, she was just really super thin. She was tall and, didn't weigh very much. And so that's hard for the body to think about getting pregnant.
Yeah. Can you speak to women who have had frequent multiple miscarriages and what they could do for that to hold on to a pregnancy?
So one of the things that has come up over the past, I don't know how many years, is this new mutated gene called the MTHFR, the mother gene. Yeah. And that one it can precipitate miscarriages for multiple reasons. And part of that is the cell division with the methylfolate. Sometimes things are not dividing cleanly. And when you get ready to ovulate and you ripen an egg, okay, that egg ripens with 46 chromosomes. I know. I get there. It's getting late. It's getting late. With 46 chromosomes, which is a whole human, right? Well, you can't send 46 down to meet with another 23. That just wouldn't work. So this egg actually has to divide into 2. And 23 of it heads down the fallopian tubes to meet up with the other 23 from the male to create a 46. Now, if this 46 doesn't divide cleanly and it accidentally holds on to extras, then you can get things like Down syndrome, trisomy 21, 13, 18, or maybe something that's just incompatible with anything being able to form properly. So you want that methylfolate to make sure everything is subdividing like it should. If a baby gets conceived and it burrows in and implants the placenta, it's very fun to watch this on the screens.
Yeah,
actually.
I know.
And it burrows into the lining of the uterus where the placenta burrows in. Some women can have clotting issues because of this gene. And it can create a little clot either under the placenta or between the 2 membranes. And for those of you that might have experienced this, they will look at something because of bleeding going on during a pregnancy, and they'll say you have a subchorionic hematoma, which means there's a blood clot between the 2 layers, the chorion and the amnion, right? So, or it may be a blood clot that's under the placenta and the baby wasn't able to stay. So many of us, what we recommend is if you have multiple miscarriages, one, make sure you've had some testing for your thyroid and make sure that's not an issue for you. The other thing is we say use a progesterone cream or wild yam capsules to boost your progesterone.
Was progesterone.
Yeah. And you start it from ovulation on, and you stay on it until you get a negative test and your period comes, and then go off of it, go back on it again after you ovulate. The other thing is a baby aspirin. You can get baby aspirin from any store. It's 81 milligrams, and this helps to prevent that blood clotting that can sometimes be the kicker to keeping these babies from habitually letting go. Now, there may be other issues going on as well, but those seem to be the two. Those would be
like your first.
And you stay away from early ultrasounds, okay? Because just personally, we've sort of seen that maybe there's a correlation. I don't know, but staying away from them.
Noticed that.
Yeah,
possibly.
yeah.
Okay.
I know you want to go in because you want to see that there's a baby in there, but stay away from them at least till 10 or 12 weeks. Let the baby get looking like a baby.
Yeah. That makes sense. There's no real studies on what that does to a developing fetus.
There's some studies that can say that maybe there's more hearing deficit and things like that, but I don't know if they've done enough on that one yet.
Okay, someone is asking, if someone is taking Vitex to get pregnant and then they get pregnant, how should they discontinue? I always worry that it would make you lose a pregnancy if you stopped cold turkey.
Right. So my understanding with Vitex is that, you can stay on it an extra week or so, but swap over to the progesterone, because the Vitex is really good for supporting the hormones to create ovulation and ripening those luteal and all your good follicles, okay? But it's not necessarily the best one at maintaining the pregnancy, so getting on the progesterone ones would be the best.
That's good. Okay, what prenatal do you recommend? What brand? That's a good question.
Personally, I love Innate Response. It's starting to be able to be gotten from Amazon. Some of the health food stores are holding it. So I like Innate Response because it's a whole food prenatal. I like Garden of Life, Code Raw, Rainbow Light. There's several brands, but you want it to be whole food so that if you smell it, it smells like food, not like it's been blasted with B vitamins. Because those are really hard to take.
Yeah. I like all those brands that you mentioned. I've tried all those. Okay, someone asked, what's a natural way to support your thyroid? I struggle to get pregnant and keep my babies due to my thyroid. Are there herbs I can take to help with that?
Well, first of all, is your thyroid struggling to a point that you should be on medication? So make sure that that's being balanced with a physician. On a midwifery level, if we just feel like the thyroid is a little undernourished, you can use either iodine drops. I love kelp. You do have to be careful of a lot of your soy foods, so be careful of that. But iodine and kelp are really good for strengthening the thyroid, as well as there are some thyroid herbal products that work really well. Standard Process has what's called thyrotrophin. That one I love, barring that you can tolerate the bovine that's in it, or that you don't have. I don't know if that one's gluten-free or not. But I love that one. That one supports really well. And you can usually order that on Amazon. Some chiropractors carry it and things like that. I know, we look pretty good, huh? Click, where's the camera? They're all out here.
Okay, what about a male who has low sperm count?
Zinc. Zinc. You need 50 milligrams of zinc. It's good for women and it's good for men for sperm. Really helps with motility. The zinc does. The other thing that males need to do is get off of any kind of artificial sweeteners. Also, so
no diet sodas.
No diet sodas. Get off of those sugar things. Start taking zinc.
No energy drinks.
No energy drinks. And they need to be taking methylfolate too, because they're subdividing in there, and that's the other side of the 23 coming through.
Yeah, I love that. Male health. We don't talk about that enough.
I know, it's true.
Okay. I know, you guys. She's amazing. Don't you all want her? Aren't you jealous?
You're so sweet.
Aren't you jealous of me?
So she's on. Yeah, you're on thyroid medication. Yeah. So you just need to make sure that you keep it monitored. When you get pregnant, to make sure that you're taking the appropriate dose. 100 is is okay. You probably could take a little bit of kelp or a drop or two of iodine if you wanted to, if you felt like you needed more. But be aware, if you're on medication and your labs are being watched, that you just want to make sure that your level stays appropriate, okay? Because that's not only helpful for you, it's also helpful for the baby. But you asked me, struggle to get pregnant.
Yeah, that was the question I read.
Yeah.
Okay, what about a good way to prevent pregnancy without using hormonal birth control, and also something to help with painful ovulation?
So, which one are we doing?
It's this one. Right here.
Read it to me again.
Okay, let's see. What is a good way to prevent pregnancy without using hormonal birth control, and also something to help with painful ovulation?
Okay, so good birth control without using hormonal. All right. If you have had a baby,
I know what you're going to say.
If you've had a baby and you're not having periods, the best thing that you can use is condoms. That's really about the only thing. Some people do the pull and pray, which is exactly that. And we midwives, we say, you're going to keep us in business.
Yeah.
But we really, really, really would prefer that, that you don't get pregnant again for like a year, 9 months to a year, because your milk supply cannot sustain if you get pregnant really early. It rarely can moms keep up a milk supply that can sustain a baby under 6 months. So, what birth control? Condoms. There are a few other little things that are out on the market that I see.
I always say, it's hard when you're not ovulating.
Yeah.
When you're not ovulating,
I
say if you're ovulating, then you don't have to use them all the time. You can use them just during the time when you're fertile. But if you're not ovulating, then you kind of have to use them all the time.
Yeah.
But anyways.
So if you're not breastfeeding and you are having cycles, look at natural family planning. And that is something that you have to do with both you and your partner and a calendar. And you just have to be getting used to that. Use condoms if you're just starting, however. Yeah. Because you need to get used to what your cycles are doing and what your body does so that you can handle that.
So you know when you're fertile.
Painful ovulation. Some women, as that egg ripens and that fluid gets into their abdominal cavity, they can have, 6 to 8 hours where that's uncomfortable. You can use some heat. Sometimes that helps. There are certain homeopathics that sometimes help women. Semisafuga is one that sometimes can help, and there are a few others depending on what your individual symptoms are.
Oh, how do you know if you're fertile? Okay. So this is so different for every woman, right? I mean, if you're regular, let's see if I can answer this.
Yeah, go
and
for
then
it.
You tell me how.
Oh, please.
Okay, if you're having regular periods, what I actually do is I have an app called Flow, and so you can put in your periods, and it will tell you your cycle is 28 days, and then it actually tells you when your predicted date of ovulation is. Now that can be different. It can be like you ovulate 10 days after the first day of your period, or whatever it is. And one way I tell is by the mucus test. Is it the Spin-Burkett test?
Mm-hmm. Very nice.
Spin-Burkett.
You're going back into your nursing days.
School.
I know.
I was going to talk about this in my stories, but basically, you have to get familiar with your bodies, ladies. That mucus, you'll have a discharge that is very watery and very thin, and the Spin-Burkett comes from if you take it between your fingers and you pull apart, it'll be like a spindle, right? Do they call it a spindle? Mm-hmm. It connects, and it's very watery and thin. So that's when you know that you are fertile and ovulating, because that mucus needs to be really thin so that the sperm can get to the egg. So if you're regular, you can use an app, which is what I do. I can share it with you guys to kind of track your periods, figure out when you're fertile with the mucus test, and an app that, if you're regular, will pretty much predict when you're ovulating, I think, for the most part.
Mm-hmm. And you can buy little microscopes where you can look and see the ferning. Some people use temp charts and they can do it. I mean, there's so much online
the
and
temp
books
chart, the basal
about natural family planning. And it's really nice because then you're not subjected to hormones. And although hormones can just keep your periods away, that's not really what your body was intended to do. Your body was intended to build a lining and shed it and build a lining and shed it. And we know that there's more risk of, you know, ovarian cancer and uterine cancer and breast cancer and all that kind of stuff from using birth control. So it's better to stay away from it.
I agree. Okay, let's see. We're getting to the end of our list, so we'll start. This is getting lengthy, but I know it's so good. You're blessing us with all this information. So maybe let's talk about 2 more things, and then we'll open it up to a few more questions. But I feel like we've covered quite a bit. So someone asked if midwives typically help with breastfeeding help. And I can speak to that because with my first baby, this one camped out on my couch for like 3 days while I figured out how to breastfeed because I could not get my baby to latch. And so she was amazing. I'm sure most of them are, but what do you have to say about that? That's maybe not normal. Maybe they would just send you to a lactation consultant.
So my live last night was talking about that. So all midwives have a basic understanding of supporting breastfeeding. And some of us, like myself, I've done a lot more extensive work with that. So I will troubleshoot more, but some midwives everybody will do the basics of making sure that baby is suckling well, troubleshooting basic things. Some midwives feel like for them, they're ready to have a lactation specialist come in. For me, I do all of that, but that's me. So don't expect that from every midwife.
To ask your midwife.
Exactly, yeah. And they should be able to troubleshoot basic things. And that's why when I was doing my live last night, it was helping families to understand. An obstetrician is there to assess the birth giver before and after. Has nothing to do with the baby afterwards. That goes to the pediatrician. And unless the pediatrician is trained and specializes in lactation support, don't expect them to understand everything about breastfeeding. Their job is just to weigh the baby and make sure the baby's getting fed, however way that is. So you may have to go and get a lactation specialist. Your midwife, if you hire a midwife for home birth or a birth center birth, they should be able to help you do most of the basic things. And some of us do more.
Awesome. I love that. That was such a blessing to me. I don't know if I would even, you would have referred me somewhere else, but it's just so stressful, especially with your first, and you're like, I have to feed this baby, and they're not latching. Like, that was hard.
It is.
Really grateful for you.
And it makes you tired, and then there's a whole lot of extra work, and you do. That because we're monitoring both you and the baby, that's our job. Our job is this baby doing all right? Is this mother doing all right? What do we need to do to make sure that everything is coordinating the way that it needs to be? Yeah. And breastfeeding is instinctual. Breastfeeding works until it doesn't.
Oh man.
And then
it
takes
it
takes patience and determination with it.
Yeah, for sure. Okay, someone asked how to survive the first trimester. Any tips?
Oh yes.
Man. That is what I have to gear up for. I'm sick till 26 weeks. It's awful. How many pounds do I lose in the first 4 months?
That's why you have to gain weight before. That's why we tell women that. So how did you survive?
I don't survive.
Well, you obviously did. You had 3 kids.
I don't survive, but I feel like I've tried the things that they usually try, and nothing helps me that much. Mm-hmm. So I'm not the best person to ask.
All right, so it is individual. Every woman responds differently. There's some very basic things, and one of it is don't ever get dehydrated, so you have to make sure that you keep drinking and change the things that you drink unless there's really something that goes down well, because the more you get dehydrated, the more concentrated your hormones get, and the higher those hormones are, which means the more nauseous you're going to get. The second is if you get hungry. Never, ever, ever get hungry in the first trimester. Nibble, 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 nibble. And if you even think about food, nibble. And if people ask you what you want, by the time they bring it to you, you have thought about it, salivated about it, and now you're nauseous at it. So we've said, put things in the bathroom at night, put a little glass with about 2 ounces, maybe 2 of them, of something, and preferably like coconut water or something that's got electrolytes or that's got lemon in it or something, not just plain water most of the time. Lovely. I'm just reading. I'm not used to reading my messages. And also put something that's just very...
She said all this birth talk makes her want another baby. So
oh, I know.
You must be doing something
I know.
right.
So the other thing is put something that's, whether it's 5 little Cheerios, 2 little crackers, something that doesn't take much to ingest, and go back to bed. But if you get up twice at night, you need fluids and you need some food, and go back to bed. Before you get up in the morning, have somebody bring you a little bit of a smoothie or the Cheerios and the crackers or whatever you need. Eat it and don't get out of bed for 15 minutes. And when you get up, start your process. And I've said to women, birth givers, that your partners, they need to make brown paper bags to put in the fridge. They put a quarter of a sandwich, little bits of things, a little smoothie. If somebody brings you a big plate, you're over it. And don't ask her what she wants, just bring her something small.
Yeah.
That's right. And make sure that you, as the nauseous person, that you go and grab the bag, you get into it, and you eat the fishy crackers and the quarter of the sandwich, and you drink the water, and you don't think about it. Because if you think about it, it's too late.
See, I'm the worst at that. Because
Well,
I just
most
want to
people
lay
are.
on the couch and...
I know, and drool,
oh,
right? Yeah.
It's just...
Yeah, and you know what? Some of you are so pristine eaters, and the only thing you can eat is fishy crackers or Cheetos.
All I can eat is
And
Cheerios.
donuts.
Cheerios.
Yeah, I know. Well, there's nothing wrong with Cheerios.
No.
And
nothing.
and
It's
babies gain micronutrients. I can say this innate response. A lot of the moms that have tried it
That's
say,
a multivitamin. Right?
yeah, is a prenatal, the baby and me. They tend to say that their nausea is better, which means that the other thing you can do, aside from that, is vitamin B6, right? 25 milligrams taken at multiple intervals, no more than 200 milligrams total, so no more than 8 doses in a day, can often make a difference. And yes, sometimes we have combined B6 with Unisom to be able to get a mom to stop throwing up all the time so she can maintain fluids. Now, here's a warning label about Unisom. First of all, I don't know your history. I don't know the drugs that you might be on. I don't know any of your risk factors, so you have to take that into account. But Unisom, when you go to the store and you look for it, whether it's generic or an actual Unisom, turn the box over and make sure it says doxylamine, okay? Because it might say Unisom chew tabs and Unisom gel caps. And you think they're the same medication, and they're not. One of them is doxylamine and the other one is Benadryl.
You don't want the Benadryl.
You don't want the Benadryl.
Okay.
It will dehydrate you, and that's the last thing you need.
Okay. So doxylamine, not Benadryl.
Yeah.
Okay, that's good. Okay, let's talk one more thing, then we'll do a couple questions, and then we're going to wrap it up.
Yeah,
holy
2
cow.
hours. My goodness.
Okay, postpartum depression.
All right. So people who do counseling for postpartum depression, one of the things they know is that the birth can make a difference whether that postpartum depression happens. Because often the experience of the birth, if it was traumatic or it was not what they wanted or expected, can leave them feeling very depressed and why did this happen to me? And especially if breastfeeding is a challenge that goes along with it, and then you have sleep deprivation, and then everybody's not doing good.
Yeah.
So rule of thumb is postpartum depression is clinical depression, where it's chemical is a different story, okay? That has to be handled. But the majority of women that have, which is not chemical depression, is because they need to talk through their story, they need to be validated at what happened, and be able to understand all that they did was a great job, and they need sleep. Postpartum depression and sleep deprivation are so hand in hand. And sometimes if they've had a high maintenance baby, or maybe they've had to pump, syringe feed, and breastfeed, and they're totally exhausted, and they have a baby who's high maintenance, sometimes for a few nights, you've got to do whatever it takes to get this mother her rest. Because once she can rest, she can then regroup and see what's going on.
Yeah.
So that's one thing. The other side of it, I have had women that I have recommended taking what's called SAM-E, SAM-E, 400 milligrams, and sometimes that boosts those neurotransmitters back up. That serotonin helps them to have some dopamine so that they can sleep.
Homeopathic, right?
That is not. It's a supplement.
It's a supplement. Okay.
And what it does is it produces serotonin, dopamine, and norepinephrine in the body. And the SAM cycle is part of a normal cycle in your body. And sometimes when you get going too far, you need a little boost to get you back up on hill.
Yeah.
Homeopathically, there are great things that you can take, but they're all a little bit individual.
Okay.
A good B vitamin, taking your prenatals can help. But a lot of times it's validation. Sometimes you're just exhausted, you know? You're exhausted.
Totally. I wouldn't say I have postpartum depression, but for the first year after I have a baby, I feel like I'm in a fog. I'm just like happy, so happy, a little emotional, a lot emotional probably, you know, kind of up and down, but just in a fog, like a total fog, you know.
Yeah. I have seen the placentas help.
Yeah,
placenta encapsulation.
I
Does
think that
seem
helps
to
a
help
ton for me.
do that
for
bridge. Yep.
Yeah. Okay. 2 questions.
I'm game. I'm sitting here. You guys are amazing.
I mean,
just
I just feel
amazed.
like I only have you once every 4 years, so we just gotta get to it all. So we'll take a couple of questions. I feel like we've touched on a lot of things, but if there's something we're missing, HELP syndrome. Is someone who's had HELP syndrome a candidate for home birth?
Yes.
Yes.
Does it mean that we're going to be really watchful and we're going to be really educating about supplements? Yes. How many times have I...
First of all,
yeah.
for the masses, what is HELP syndrome?
You're going to make me remember.
I can't remember what it stands for.
Don't make me do that right now.
Light liver...
Yes, and you know, I
can't remember.
I've dealt with it twice in 900 babies. Okay? Twice. And that was in past babies, not that they had HELP syndrome with us.
Oh, okay.
Okay?
So, like, in their history, they had it.
Right.
Okay, but they are a candidate for home birth. They're just going to be more monitored.
That's right.
Okay.
And if something goes out of balance, then they're going to be transferred back. And maybe they want to have concurrent care because of that.
Yeah. That's fine.
Yep.
Cool. Okay. How does someone find a midwife like you?
Okay. Well, in the Sacramento area, you go to the Midwives Collective of Sacramento and you look.
Yeah, if someone was like, okay, I want to interview, we have 2 minutes. We're going to get cut off in 2 minutes.
Okay, then this is going to be it.
This is it. Okay. They go, what do they do if they're like, I want to find a midwife tomorrow. I live in Portland. What should they do?
Go on, look for a midwife association in Washington State, which they have. Any state that you're at, go and look for a midwife association. Second to that, look on mana.org. They have an area where you can find midwives throughout the United States. Those are probably the 2 easiest.
Okay, so MANA or a midwife association in your state.
Right, and MANA stands for Midwives Alliance of North America.
Hemolysis, elevated liver enzymes, low platelet count.
Thank you.
That's right. I knew there was liver and hemolysis.
It was not coming to my brain tonight of remembering all of the beauty of that.
Yeah. Okay. All right, you guys.
You're amazing.
Yeah. Thank you so much. Seriously. Okay, so she Instagrams at Natural Childbirth 101.
Yep.
Guys, I mean, I don't need to tell you.
Oh, you can't see that anyway.
You have seen it. So follow her.
Come
She's
on
gonna
over.
have her course.
Yes, come on over. Come listen to these.
$25. That's it.
That's if you want the
so
whole
worth it.
series. If you just want to listen to it, because they're going to be released one a day for you. If you go on over there, the little bot's going to put you into the robot, and it's going to release the videos all in order over 40 days. If you want it all, then you can pay $25 and it'll all get delivered
it's just
to you.
free.
Yep.
Amazing.
And
okay, hearts for her because she's amazing. I love her so much. I wish I could share her with all of you.
Oh, yep.
Thank you for being here.
26,
Seriously,
25.
I know.
We're good.
We have 12 seconds.
You're amazing. You're wonderful. Thank you so much
Love
for
you all.
joining us.
so much.
Bye now.
Thank you.
Thanks, Allison.
All right.
Live video.
That was